So something that we should go over, but is not really doesn't have many. I mean, it has one slide for it, but it's important to know is the naming of skeletal muscles. So they're named usually by location, size, direction. Can be the number of origins, location of origins, and insertion and action. It just depends on the muscle. So the an example of location would be the frontalis, that muscle. Obviously, it's the location of where it is. Um, Direction of fibers, external, abdominal, oblique, edge of the lower rib cage. Okay, the number of origins. An example would be biceps. Okay, biceps have two-headed muscles. It can be location of origin insertion. So that would be sternocleidomastoid. The origin is the sternum and the clavicle, and the insertion is the mastoid process of temporal. Or action. So flexor carpi ulnaris flexes the wrist. So it's saying the flexor is what it is. It's the action. The same thing with extensor. The extensor carpi ulnaris extends the wrist. Um, or the depressor. So the depressor anguli oris depresses the corner of the mouth. Or a depressor can raise or lower body parts. So those are kind of how they are named. They're also subdivided into muscle regions: head muscles, neck muscles, trunk muscles, extremity muscles. There are, as I said before, 656 muscles, 327 are antagonistic, meaning they work against each other. Two unpaired muscles, the orbicularis oris and the diaphragm. Okay. Next, we're going to talk about how exercise and training change muscles. So, exercise and trainings can alter the size, structure, and strength of a muscle. Unused muscle atrophy, and you remember that term, atrophy means they decrease in size, kind of like muscle wasting. But when you exercise, muscles increase. So, muscles have to be stimulated in order to work. So you have muscle innervation. And when you have muscles that are stimulated to exercise, um, you have to, it's kind of like muscle memory. Like when you move, you do the same thing over. It improves um, the muscles that are stimulated by nerve for movement to occur. It improves the cortical brain region where nerve impulses start for muscle movement. So when you're doing the same thing over and you're working out these muscles, they're getting bigger, you're developing muscle memory. Okay. Um, we talked all about size and structure. Atrophy is the shrinking of muscle size due to lack of use. Hypertrophy is enlargement of the muscle size due to excessive use. Um, if you overwork your muscles and you can get tears, you can develop scar tissue, and that can cause muscle damage. If it gets severe, it can limit the movement of the muscle because it's scar tissue. Um, Improved exercise and training are improved coordination. Antagonistic muscles relax when they're supposed to and don't interfere with the working muscle because it is a purposeful movement. And again, you have muscle memory. Um, you eliminate or reduce there's elimination or reduction of excess fat because fat, you need glucose to run your muscles. So if you don't eat a lot of sugar, you do a lot of exercise, it'll burn the fat for the sugar that's already stored in your body. So the less calories you take in, the more the fat is burned. Muscle memory, also an exercise improves movement, a particular movement. If you The effect of training on muscle efficiency: increase muscle size, improve coordination, elimination of reduction of excess fat, improve joint movement. So that's it in a nutshell. Then we have muscle massage. Um, I don't know if any of you have had a massage. If you have really sore muscles, it's just a wonderful thing. I had my neck really hurt. I couldn't turn my head. I went for massage. She massaged it. And when I got out of there, I could finally move my head again. It had been like 2 days. It happens a lot when you're nursing because you're pulling a lot of heavy things, pushing people, pushing beds, pulling people up in bed, and you can get injuries. So when you have a massage, if it's done right, okay, if it's the proper physiotherapy, it can provide for a sense of comfort and well-being to a patient. A lot of people will fall asleep. Um, Healthcare professionals must be aware of specific skeletal muscles involved in therapeutic massage. This is a really important one. I have a terrible back. When I go for a massage, I always tell them do not do deep massage in my lower back because what they do is they do the deep massage, it irritates the nerves, and then the muscles tense, and my back hurts. So they have to be really careful about that. But massage improves in circulation, and it's also um, causes the release of stress reducing hormones. It fosters faster healing of strained muscle because it improves the circulation. So um, you have to have this done by somebody who is trained to do massage because the ability to locate skeletal muscles in living bodies of patients um, can be challenging because everybody's different. Everybody has different physiques. Electrical stimulation. Passage of electrical currents through the skin into the body for therapeutic uses. Okay. Um, it's used in PT quite a bit, actually, and it helps increase your range of motion, your muscle strength. It re educates your muscles, it improves muscle tone, enhancing function, controlling pain, accelerates wound healing because, again, it increases circulation, and it reduces muscle spasms. So, what they do is they run that electric, it stimulates the nerve tissue, and it helps the nerve. Once you stimulate the nerve tissue, it moves the muscles, and it can help you improve your muscle health. And finally, one that's near and dear to my heart, intramuscular injections. So there's two different kinds of injections. There's subcutaneous and there's intramuscular. Subcutaneous are things like insulin. It goes into your subcutaneous layer. It doesn't hurt at all. Intramuscular injections can hurt. The best thing to do when you have an intramuscular injection or IM injection is relax. If you relax the muscle, it'll be fine. So common sites for injection is your deltoid. So if you want to find that landmark, you put your 4 fingers at the top of the shoulder, and at the bottom of your hand is where you give the shot. The vastus lateralis, which is the anterior thigh, and the dorsal gluteal or ventral gluteal in the buttocks. Now, the dorsal gluteal and the ventral gluteal are not something they do a lot of anymore because of the sciatic nerve. A lot of people prefer that. I usually gave shots in the deltoid, and I also gave them in the vastus lateralis, or I even gave them in the front of the leg too, the big muscle in the front of the leg. But it, it's you have to do it in a big muscle. Okay, that's about it for that, and we will be doing disorders next. Okay.